Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this particular session, I'll be discussing the quiz which I have posted on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, on 14th of May. So every day I am posting the quiz on my Telegram channel, and on the subsequent day I am sending you the explanation as well. So as a part of its discussion, the first question is: spastic paraplegia is caused by all of the following except. The options are vitamin B12 deficiency, cervical spondylosis, lead poisoning, motor neuron disease. So the correct answer here, the question asked is except. So it is the lead poisoning, because in lead you take spastic paraplegia. What is this? You come across this in case of the UMN lesion, right? Whereas the lead poisoning is that which is associated with lower motor neuron type of paralysis. So in case of lead poisoning, you will not have spastic paraplegia. What you will have is the flaccid paraplegia. And lead poisoning is associated with multi-system disorders. One among that is the involvement of the neurological disorders. And what will be the other neurological disorders apart from lower motor neuron paralysis? It is also the one which is associated with the headache. There can be also development of the irritability within the individual, and there can be also even development of seizures. And gastrointestinal manifestation can be there in the form of the abdominal pain, and hematological manifestation will be there in the form of the anemia. Then in severe cases of the lead poisoning, the individual may also go into a state of coma and as well as death. Then how do you treat these patients with lead poisoning? Usually you need to avoid the source of lead poisoning in the individual, and only in severe cases when the blood levels have been elevated beyond the normal limit, that is the point when you need to give the chelating agents. And that particular chelating agents are: number one, DMSA, which is nothing but succimer, and the other one is calcium disodium acetate. So these two are the important chelating agents for the lead poisoning. And remember, in lead poisoning, the type of paralysis that you will have is lower motor neuron type of paralysis, but it is not the upper motor neuron type of paralysis. Next question. Beaver sign is seen in the abdominal muscles, facial muscles, respiratory muscles, and then the hand muscles. Remember, Beaver sign is the one which is seen in the abdominal muscles. And what is the importance of the Beaver sign? So Beaver sign, it tells you the strength of the abdominal muscles. Okay, it is assessing the strength of the abdominal muscles. And what exactly is the Beaver sign? So you take in a normal individual. In a normal individual, whenever he raises the head and whenever he raises the shoulder, the umbilicus, it will be in the center, right? And it does not move upwards. So whenever the individual raises the head or shoulder from supine position, the umbilicus, it will stay within the normal position. Whereas if there is upward movement of the umbilicus upon raising the head, that is what is called as the Beaver sign, right? If there is upward movement of the umbilicus when there is head arousal, then that is called as the Beaver sign. And what it exactly signifies? The presence of the Beaver sign signifies that there is abdominal muscle weakness. That is what is the importance of the Beaver sign. And it also indicates the dorsal myelopathy. Dorsal myelopathy at D10 spinal cord level. That is the importance of the Beaver sign. And you take the third question. Most common drug used in the spasticity with spinal cord injury is diazepam, tizanidine, salicylates, baclofen. So spasticity, as already just now we have discussed, it is seen in the upper motor neuron lesion. You come across this in case of the spinal cord injury, and this spasticity can be relieved by the baclofen. And baclofen is what? It is the skeletal muscle relaxant. Whereas you take the tizanidine. Tizanidine is also the skeletal muscle relaxant. But where do we give this tizanidine? We give tizanidine in the treatment of multiple sclerosis, right? Diazepam, it is used as the anti-epileptic drug in status epilepticus. right? In status epilepticus, it is used as an anti-epileptic drug. And salicylates, right? Salicylates, the salicylate which is very, very important is the aspirin. Where do we use aspirin in neurological disorders? That is in patients with transient ischemic attack. And we also use aspirin as the anti-inflammatory agent as well. So in case of TIA, it is being used as the anti-platelet agent, right? That is about the question related to the spasticity, the drug used in spasticity with spinal cord injury. The answer is the baclofen. Next, followed by that, we have two questions related to the facial nerve. Facial nerve palsy is associated with all of the following except Bell's palsy, Ramsay-Hunt syndrome, Melkerson-Rosenthal syndrome, and then the Todd's paralysis. Bell's palsy, yes, right, it is the idiopathic cause for seventh nerve palsy, and it is lower motor neuron type of paralysis, and that is associated with the facial nerve paralysis. Ramsay-Hunt syndrome, right, even your Ramsay-Hunt syndrome, it is also the one which will cause the facial nerve paralysis, and it is a complication of the varicella-zoster virus. And what will be the features of Ramsay-Hunt syndrome? It is characterized by a triad. What is a triad in Ramsay-Hunt syndrome? That includes ipsilateral facial nerve paralysis. There will be otalgia, that is ear pain, and there will be also vesicles in the auditory canal or auricle in case of the Ramsay-Hunt syndrome. So this is a triad of Ramsay-Hunt syndrome which is caused by varicella-zoster virus. And the next important option is the Melkerson-Rosenthal syndrome. Melkerson-Rosenthal syndrome, we have a separate question on this, but that is also the one which will cause the facial nerve palsy. But you take the Todd's paralysis. Todd's paralysis, it is nowhere related to your facial nerve paralysis. Then what exactly you understand by this word Todd's paralysis? See, in case of Todd's paralysis, the individual will have the epilepsy, or the individual will have seizure for a longer period of time. Now, after having seizure for a longer period of time, followed by this seizure episode, there will be paralysis. That is what is called as the Todd's paralysis. And in Todd's paralysis, you don't have the involvement of the facial nerve. So the one which is except the one which is not associated with facial nerve palsy, that will be the Todd's paralysis. Then followed by that, yes, Melkerson-Rosenthal syndrome is, the options are the recurrent facial nerve palsy plus permanent facial edema, then recurrent facial edema with permanent facial nerve palsy, seventh nerve palsy plus eighth nerve palsy plus vesicular eruptions in the external auditory canal, lower motor neuron lesion of the facial nerve. So if you take the Melkerson-Rosenthal syndrome, it is the one where you have recurrent facial nerve paralysis. Along with that, there is also the facial edema. And in case of this Melkerson-Rosenthal syndrome, it is also the one which is characterized by a triad. What is a triad in Melkerson-Rosenthal syndrome? Number one, there will be recurrent facial nerve palsy. Number two, there will be swelling of the lips. Number three, there will be fissured tongue. So this is what is the triad in Melkerson-Rosenthal syndrome. So these are the 5 questions of the quiz which I have posted on 14th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So you can join my Telegram channel for daily quiz discussion. Thank you very much. See you tomorrow.